The UCSF Peripheral Nerve Clinic that we started back in 2019 was started by 2 plastic surgeons and 2 orthopedic surgeons. The reason we started this clinic is that we would see in our individual clinics some high complexity injuries that required care from multiple people, and it was hard for them to navigate the healthcare system.
Many patients have nerve-related injuries that are extremely complex. They could be injuries that have happened in the past where they haven't had recovery. Sometimes people are referred late after the injury. So in those types of situations where they have a very complicated nerve injury, it helps to have people of different backgrounds who specialize in nerve surgery all coming together as a group to put our heads together and give the best diagnosis and therapeutic plan that we can for each patient.
We treat patients who have injuries to their brachial plexus. We treat patients who have injuries to nerves in their upper extremity, like at their hand, wrist, or elbow, or higher, and also nerve injuries to their lower extremity, like, for example, injury to the common peroneal nerve. We also see patients who have cervical spine injury, who cannot use their hands or their arms, and we can help restore their function with nerve transfers or tendon transfers. We also see patients with spasticity or contractures of their upper extremities, and we can help them regain function with other operations like fusions or even Botox injections. We also see a lot of patients with chronic nerve pain. These are patients who may have had an amputation, for example, of their upper or lower extremity, and have chronic pain as a result of that, or phantom pain. We also see patients with chronic regional pain syndrome, or CRPS. And oftentimes we can identify a specific nerve problem that is at the root cause of their pain. And we have a lot of modern surgical solutions for that, TMR or RPNI, and these are relatively new developments in our field.
We all specialize in hand, upper extremity, and nerve surgery, but some are orthopedic background and some, like myself, are plastic surgeons as well. In addition, we have a physiatrist who will help us with performing nerve conduction studies and EMGs. We also have ultrasound specialists, pain management specialists, all coming together in one group with our hand therapists, so we can provide all the care that these patients with these extremely complex problems and issues require.
So at the Peripheral Nerve Center, a lot of patients, especially new patients, will see me first, where I'll do the diagnostic nerve and muscle tests, and nerve conduction study, and EMG. And basically I'll evaluate the nerve kind of from the brain all the way down to the fingertips and really try and figure out where that problem might be happening.
What I specifically do as part of the team is I do diagnostic ultrasound. So I'll look at the brachial plexus, which is a web of nerves around the neck. I'll look at peripheral nerves, and I'm able to really find exactly where the pathology or the problem is within the nerve, which is able to help our team of physicians and surgeons identify what would be the best treatment for them.
Patients come in and they will actually meet all of us at once. So usually it's 4 surgeons. The beauty of that is that you have to tell your story once and you have 4 people listening. And once we have that conversation, we all give a consensus opinion.
No waiting around or trying to wait for another appointment, go to another facility. Everything's done within the same 1 or 2 rooms that you are in the visit for. And once we get those results, again, they bring you back and evaluate all together. That's pretty much it. The appointment will usually run about an hour, 2 hours, depending on the situation.
It's very heartwarming for us to see the patients who can return to their lives, have less pain, more function, be able to get back to work. And that's what motivates us to come back and treat these patients every day.